Good evening, everyone. Since we have been going from anterior to posterior, we're back again on the most anterior part, which of the that is the refractive surgery. So there are a lot of refractive surgeries being developed over the years, starting with PRK, which is surface ablation, and over the years, flap-based, blade-free. The first key leg surgery, that is keratolenticular extraction, which was the SMILE procedure back in 2012, and now the new kid in the block, which is the silk procedure. So currently there are four major keylegs platform. One is this Zas's Visumax 800 Pro, the J&J Silk Elita platform, Atmos platform, and the Zimmer platform. So I'm going to share my experience with the J&J Elita Silk platform. So before going to the platform, I would like to tell you the difference between the two. That the keylegs procedure is basically flapless. You don't have to create a flap. The lenticule which we make is via a femtosecond laser. Recovery is much faster. Dry eye is much less common compared to the flap-based surgeries. The corneal biomechanics is nicely managed with it. So the Elita platform can correct up the diopters up to half diopters to 12 diopters, and astigmatism from 0.25 to -6 diopters. It does not correct hypermetropia yet. So this is the Elita platform. As you can see, the big screen here is for the engineer or the optum, which helps to plan the treatment and give the basic treatment plan. The small screen is for the surgeon, which helps during the docking period for proper applanation and to see whether there is eye movements or not. The joystick obviously for the docking process, and the small prism, as you can see here, acts as a high resolution camera which helps in visualization because it does not have a microscope, so we are dependent on the screen itself, and also has a motion detection property. The few main points about this platform is that it has the shortest pulse duration, which is of 150 femtoseconds. So shortest pulse duration means that there is less tissue to no tissue disruption, and the surrounding tissues do not suffer from any thermal energy. The spot size, which I would say is the least in compared to all the platforms out there, which is less than 1 micron in space, as you can see, and it delivers a very high speed laser delivery for femtosecond, that is the 10 megahertz. So when we do the dissection for removal of lenticule, it's minimal to no dissection. The another key feature it has, when we it gives a laser cone or PI when we attach it, the machine itself automatically every time detects the surface, knows its thickness and its orientation and tilt, and adjusts the laser accordingly. So we get repeatable and predictable laser delivery every time. The key feature of the Elita is that it is the only platform which gives a biconvex lenticule. All the other platforms give a plano-convex lenticule. So biconvex lenticule has a few advantages, that when the anterior and posterior lenticular surface are matched, the Baumann layer is maintained, there is less corneal folds, nerve generation is maintained nicely, and the biomechanical strength is nice. It also gives a transition zone, as you can see, so which is not compromise the optical zone, which separates the both, and a non-refractive which helps to go inside and take the lenticule out easily. It also has another feature which we call it as the radial scan pattern, and it scans the anterior and posterior, that it cuts the anterior and posterior lenticule twice compared to the other platforms which have a circular motion. The docking is also very nice, and from my experience till now, since June I have started, it's almost 800 eyes. I would say only 3 patients have suffered docking due to their anxiety, and they just moved the eye in the last position. Otherwise, relatively, the docking is so good, it is absolutely painless. No patient has as such complained about the pain while docking. So now I'll just share a video of the procedure. As you can see, this is the machine, the platform. When the laser cone, as you can see, is attach the prism to the prism, and after applying the speculum, we just look at the treatment plan on the big screen. When the treatment plan is approved, we just scan the cone. Like I previously told you, this scanning helps every time that the prism delivers a perfect and a nice laser delivery and repeatability and predictability. I always mark the 0 and 180 on the slit lamp. People use toric marker as well because it for the compensation of cyclotorsion. Because when we dock, because it is a two-hand docking system, that a vacuum ring holds the eye and the machine is docked slowly with the prism, and they applanate the cornea. As you will see now, it is slowly applanating the cornea on the ring which I have placed. Once the applanation is okay, as you can see the tear meniscus spreading and it's beyond the 10 wide zone, we just lock the vacuum so that we can, and after locking the vacuum, either the opton or the doctor can manage the cyclotorsion which or dilatation which has occurred, or the centration the doctor can manage from his small screen which is there. Once everything is fine, we just start the delivery process with a foot paddle. As you can see, first the anterior surface, and then the posterior and the non-applanated, the non-refractive area gets separated, and then the 2 to 3 laser entry point. I prefer 2.5. Once, as you can see, a nice OBL and nice lenticule is made, we shift the patient to the other OT under a microscope and start with the lenticule removal process. Once the entry point is found, as you can see, I look for the anterior surface. Knowing the anterior and the posterior is by knowing the OBL. If the instrument here, you can see I'm in the anterior plane, the OBL is not there, that means you're in the anterior plane, and in the posterior you can see the above the instrument there is OBL, that is the opaque bubble layer. As you can see, the dissection was quite smooth, and the lenticule was removed very easily and very smoothly, just like silk. And after checking this lenticule is properly dissected, I just iron the cornea with the cannula and also with the spud, uh, just just for extra precaution that there are no bomb and folds for the surgery. Another technique which is now more popular is the lenticulo-capsular After the entry point, just use a micro dissection forceps. I go anti-clockwise and just remove the lenticle smoothly with one swipe. And just open it and check it properly whether the lenticule is perfectly dissected. And yeah, that's about it. So, in my experience with Silk Alita platform, doing 800 eyes till now since June, I would say patient gets about 20 by 20 vision, or 89% of them get 20 by 20 vision or more on post-op day one. But by 1 week to 15 days, most of them get 20 by 20 or more vision. And I have received only around 300 to 325 eyes to be more specific on a 3-month follow-up, where almost 99% of them have got 20 by 20 vision or more. Thank you so much.